Yes.
Introduce
Good
Khyber.
morning, everyone. I hope you are all doing well. Welcome to our exciting webinar on how to write an effective discussion for a manuscript. My name is Wahabja, and I have the pleasure of being your moderator today. We are absolutely thrilled to have you join us as we dive into this critical topic with our esteemed speaker, Dr. Liaqat. This webinar is a part of our ongoing series and pre-conference activities leading up to the third annual International Research Conference by the SRC KMC. It is the result of a collaboration between the Postgraduate Medical Institute and MTI KMC/KTH. A special thanks goes to Dr. Iqbal Haider, who is the Associate Dean Research, and Dr. Rubina Gul, who is the Chairperson of the College Research Committee, Khyber Medical College, whose tireless efforts have made this event possible. This initiative also aligns perfectly with the vision of our Honorable Dean of Khyber Medical College, Professor Dr. Mahmood Aurangzeb, who is a true champion of advancing medical education and research. Before we jump into the session, I would like to go over a few housekeeping items to ensure you have the best experience possible. To receive CME accreditation, please make sure you attend the entire webinar. Our team will be monitoring attendance. Please log in with your official name for the purpose of attendance and certification. We aim to maintain a respectful and polite environment, so please be courteous and professional in your interaction. Ensure you have a stable and secure internet connection for the best experience. Keep your microphone muted during the session to minimize background noise. If you have any queries or need help, use the raise hand function at the bottom of the Zoom screen or direct message the moderator in the chat box. Please note that the webinar will be recorded for future reference. By attending, you give consent to being recorded. Now it is my absolute pleasure to introduce our speaker, Dr. Liaqat Ali. Dr. Ali is a professor of urology at Institute of Kidney Disease, Hayatabad Medical Complex, Peshawar, and is editor-in-chief of Pakistan Journal of Urology, and also an editor for the Society International Urology Journal, Geneva. He is a clinician, academician, researcher, and educationist with extensive experience in medical writing and research. We are truly honored to have him with us today to share his insights and knowledge on crafting effective manuscript discussion. Without any further delay, let's get started. Dr. Liaqat, the floor is yours.
Thank you so much, Wahab, and thank you so much, Dr. Iqbal, for inviting me to this wonderful event. This is the aerial view of the Institute of Kidney Diseases, flanked by the beautiful view of the Hayatabad Medical Complex. This is the aerial view of the Institute of Kidney Diseases. And let me, as we are also going to have this research module starting from tomorrow, so let me start this presentation about the importance of this very important topic of the research. And I really congratulate you all for arranging such a beautiful series of the webinars on the research. That the quote is that without research, you are just another person with an opinion. So that's why research distinguishes you from the other people who might be clinicians or who might be anyone who can have a vlog and talk shows. So this is the main difference. And this is a very vibrant faculty which we have involved in our research module. Here's my brother, Dr. Iqbal Haider also. And the topic for my allotted topic is how to write effective discussion for the manuscript. And with this, I'm really extend my thanks to all the Research Society of the Khyber Medical College, which is just like my own college, my own alma mater, and Iqbal Haider for inviting me to have this important topic, because writing discussion is the most considered as most difficult portion in the manuscript writing. But at the end of this, inshallah, this presentation, every participant will be able to write effective discussion, which will be structured, and it will be very easy for them, even if they take it as an assignment. These are my some humble contributions in the research with the 78 published articles on almost all the aspects of the urology, and I had also an honor of an author writing chapters in international books in the urology. So, if we recap what already have been taught to you in the series of the webinar, that the uniform requirement of the manuscript submission has this universal format for submitting an article. That is introduction, methods, results, and the discussion. So what does introduction mean? That what are you doing? What does result means? How will you do it? What results, methods, how will you do it? And results, what you found. And the discussion, what does it mean? ये तमाम जो एक्सरसाइज होती है, इसका सारा मकसद क्या था, मतलब क्या था, ये जो चीज है, ये डिस्कशन is the portion which covers all of these portions. So the purpose of your discussion is to provide a summary of each of your results and show the readers how this result led to you a conclusion that corresponds to the title and the objective of your paper. Now, importantly, सबसे पहले हम discuss करते हैं, let's discuss first that what are being a reviewers of so many journals, including the which Iqbal is heading also, KMUJ and international journals and editors into the so many journals. What we found in a discussion as a reviewer, when you review the article, अब पहले हम अपना कॉन्सेप्ट दें. आई वांट टू गिव इट कि जब मेरे पास आर्टिकल रिव्यू के लिए आता है और मैं डिस्कशन देख रहा होता हूं उनकी, तो व्हाट प्रॉब्लम आई परसीव, the authors make claims about their findings which goes beyond their results. I would like to dissect these things in the pitfalls of the discussion too, ताकि जो मेरे अटेंड करने वाले participants हैं, they understand what I'm saying and repeating it so as they get a good idea of what I have said. The authors make claims about the findings which goes beyond their results. If the author do not go beyond the result, still the discussion is mostly very monotonous. Number three, that it is now this, again congratulate the Khyber Medical College. It is need of the day to assist the authors in detail, evidence-based guidance, how to write a structured discussion. Now, for the what are the problems if some of my participants are the students and or some residents? These basically the research that has become the Achilles heel for us as a healthcare practitioner. And also congratulate Professor Mahmood Aurangzeb Saab for such a brilliant initiative that he has started. The dean and our teacher of the Khyber Medical College. That for the new guys who would be starting the writing a paper, the student, the undergraduate, resident, so what they face, what problems they face in discussion as authors. Number one, so this is an important slide. That what does this article manuscript means to us? So it consists of the universal way of the submitting an article, uniform requirement that was from the British BMJ, is that you have to write it introduction, methods, results, and the discussion. Thoda click karen. So what does introduction mean? Yes, please. So introduction. No, नहीं बस वैसे click कर लें. नहीं introduction नहीं. आप वैसे click कर लें खाली. ये animated है.
Yeah.
Yes, like this. Okay. So introduction mean what are you doing? Next, please. Methods means how will you do it? Now the results means what you found, and the discussion means that what does it mean. So basically the format of this paper, any manuscript, the research when you want to submit it should undergo the essence of this technique. Next, please, Zia. So the purpose of the discussion is to provide a summary of each of your results and to show the reader how these results led you to a conclusion that corresponds to the title, of the paper. So that is basically the objective of writing discussion. Next, please. So, as a reviewer, I have already said, when we review the articles, what me and Iqbal and so many reviewers, which will be the participants over here, what difficulties we face. Next. The authors make claim about their findings which goes beyond their results. वो बातें करना शुरू करते हैं जो रिजल्ट्स में होती ही नहीं है इस तरह से. Next, please. And even if the author do not go beyond their results, still the writing manuscript is very much monotonous. Next, please. So it is now need of the day to assist the authors in detail evidence-based guidance about how to write a structured discussion. Next, please. So now what are the problems for the authors in the writing? वो तो reviewers के problem थे. अब authors के क्या problems हैं in writing discussion? The author found it very directionless. Next, please. They do not know how to start and how to end the discussion. Either the discussion is too long or the discussion is too short. Introduction तो उनका 2 pages का होता है और discussion से 2 paragraph पे आ जाता है, या introduction उनका 2 paragraph का होता है और discussion को 8 pages की चली जाती है. So there is a confusion that what to do it. So the pitfalls in the writing discussion are, next please. The pitfall number 1, that only rehashing what already have been said in the results section, because you know that what you should, that because you inside know that you should summarize your main results. This temptation is simply restate some or most of the values reported in the results section. हमने जो रिजल्ट में लिखा होता है, बस एक टेम्पटेशन होती है कि हम डिस्कशन में उसी को रिपीट करें, उन्हीं वर्ड्स, उन्हीं वैल्यूज, उन्हीं परसेंटेजेस के साथ. So it is so persuasive that some of the journal specifically call it in the instruction to the author that do not just restate your result. So this is pitfall number 1 in the writing discussion. Number 2, up आगे, next please, beta. This is very important. Mentioning something not in the results. And anything you talk in the result should have previously appeared in your result section. जो anything you write in the discussion. आपने जो discussion में जो बोल रहे हो, वो कहीं ना कहीं आपने result में show किया हुआ हो. For example, somebody is doing a study on the effectiveness of some medication versus another medication in like enteric fever. And in discussion, he started writing that the medicine A is very cost effective than the other. भाई वो तो आपने अपने रिजल्ट में ना शो किया, ना वो आपके ऑब्जेक्टिव में था, तो आप यहां क्यों लिख रहे हैं? So this is the second pitfall. The main essence is that you please previous slide. Never introduce new data or results in the discussion. Next, please. Okay. So interpreting the result should be in line of the context. It does not mean that my study has shown this much mean percentage or mean age and Plana has done this mean age. If your result shows that differs from the previous study or the recent studies, can you explain why? This is basically what we need from you in the discussion. We do not need the replica. आपने के बस खाली कहा जी फलाने ने भी कहा कि मीन एज इतना है और हमने भी कहा मीन एज इतना है, फलाने भी कहा कि इतना इफेक्टिव है, हमने भी कहा इतना नहीं. आप बेंचमार्क स्टडीज या किसी और के साथ अगर बात कर रहे हो तो इट शुड बी इन द कॉन्टेक्स्ट. हो सकता है कोई बहुत अच्छा ऑथर है, वो यू डू नॉट एग्री, उन आपके जो रिजल्ट्स उससे नहीं एग्री करे, तो देन यू हैव टू be particular into answering that why. Next, please. Next. Now, this is important. I have learned this technique of writing the discussion under 7 headings by Professor Jim Thornton, a very learned dean of the Royal College of Gynecology Ops, and also the editor-in-chief of the British Journal of Gynecology Ops. And he was a wonderful person. So I attended his 2 to 3 workshops on paper writing skill in Higher Education Commission. So that was very, informative. Next, please. अब एक heading से आएंगे. Next, please. Yes. So the new authors or the participants can take a picture out of it, or it is also shared with the Wahab and it has been recorded also. That these are the 7 headings which you have to memorize. Write your discussion under the subheadings of these which I have displayed. We will go one by one in each, and at the end, you just delete the headings. It will give you a very accurate discussion. According to the Professor Jim Thornton, this is not his own technique. ये उनकी अपनी कोई टेक्निक नहीं थी. It was an article that was published in 1994 in the BMJ, that how to write a structured discussion. And ज़्यादातर जर्नल्स चूंकि structured discussion को नहीं पसंद करते, तो कहते it is very easy, then you just delete the headings. So first heading is the principal statement. Second is the strength of the study. Third is the weaknesses of the study. Fourth is comparison with the literature. Fifth is the implication of studies. Sixth is unanswered question. And 7 is further research. वहां हम एक pitfall number 4 मिस कर दिया हमने. अगर आप वो पिछली स्लाइड पर जाएं तो उसको मैं एक इंपॉर्टेंट है कि वो इसके साथ कोरिलेट कर रहा है. पिछली स्लाइड पे सर जाएं, पिछली स्लाइड पे. हाँ, इसको बैक करें. Yes, this is a pitfall number 4 which was I was missing. That overstating, जहां मैंने आपको बताया कि strength और weaknesses, overstating strengths and understating limitations. देखिए, reviewers and the editors like brevity, they like clarity, and they like the fairness of the author. So be realistic and transparent about your strength and the limitation. Allow the work to stand on their own merits. Do not overinflate your strengths and do not underestimate your or understate your limitation. अगर आप अपनी लिमिटेशन लिख देंगे उससे कि आपकी स्टडी खराब नहीं हो जाएगी, ना ही वो रिजेक्ट हो जाएगी। जो हमारे जहन में है कि शायद हम लिमिटेशन लिख देंगे तो हमारी स्टडी खराब हो जाएगी, नो बडी एक्सपेक्ट एनीबडी। मतलब आप बाहर के बड़े से बड़े जर्नल्स देख लें, या परफेक्ट स्टडी तो हो ही इस तरह नहीं हो सकती कि जिसमें कोई लिमिटेशंस ना हो। ठीक है, नेक्स्ट प्लीज। वहां से सॉरी आपको मैंने तकलीफ दी। अच्छा, नेक्स्ट प्लीज। नाउ वी डायसेक्ट these 7 headings one by one. Principal statement, it should be 1 paragraph. I hope मेरी आवाज सबको आ रही है, and I hope everybody is is okay. Iqbal?
Yes, that's perfectly clear, sir.
Okay, thank you so much. Okay, so now the principal statement should be 1 paragraph. The statement that summarize your results in connection with your original rationale without mentioning figure. It should be clear and unambiguous, and you can start it like, our results confirms that this surgical procedure was found superior to this surgical procedure in our study. Next, please. And now this is the strength of the study. It should be 1 paragraph. For example, avoid using the term first study in the present setup. ये बहुत ही कमजोर स्ट्रेंथ है, क्योंकि KTH में अगर डॉक्टर हजरतुल्लाह एक स्टडी कर रहे हैं और IKD में मैं स्टडी शुरू कर दूं, मैं कहूंगा जी मेरा प्रेजेंट सेटअप में तो 3 किलोमीटर के ऊपर कोई फर्क नहीं पड़ता पेशेंट की डेमोग्राफी पे. So avoid this first strength. But your genuine strengths of the studies are if it is a randomized controlled trial, it is a randomized controlled trial, it is a larger sample size, it has the internal validation process, you have added a good record of it, और आपके पास उसके जितनी एंटी प्लेजरिज्म पॉलिसीज थी आपने वो सारी मेंटेन की हैं, ये आपकी सारी स्ट्रेंथ है. ठीक है, नाउ नेक्स्ट प्लीज. अच्छा, नेक्स्ट नो, इससे पहले स्लाइड है. Yes, weaknesses of the study. Weaknesses of the study may be in the sampling, like biases, like non-probability convenient sampling, at a very small sample size, because these both have a limitation that you cannot generalize your data if you have a consecutive sampling or a small sample size. And last is, these are the example like poor follow-up. हम लोग कभी कभी मेंशन करते हैं 500 केसेस हमने किए और फिर 500 ही का रिजल्ट दे देते हैं कि 500 में से 400 में इतना आया था और 100 में इतना आया था. This is very much universal fact that the patient loses the follow-up. So you if the follow-up is more, you write it down. It is not going to reject your article at all, but the generalizability of the article, can it be generalized or not, वो तो फिलहाल हम इसको डिस्कस नहीं करें कि वो उसके लिए कौन से फॉर्मेट्स होते हैं डिस्कस करने के लिए. नेक्स्ट प्लीज. नाउ वी कम, जो हम सबसे ज्यादा करते हैं मिस्टेक्स, comparison with the literature. Next, please. Next. अच्छा, Comparison with the literature is important. You have to write it into 2 to 3 paragraphs. One thing should be clear. एक बहुत नामी गरामी प्रोफेसर साहब का एक आर्टिकल मेरे पास आया, and his study was basically a descriptive study. At the end, he said, "Nah, descriptive study, typical descriptive study थी, but he mentioned it is a comparative study." मैंने रिव्यू में लिखा कि सर आपकी स्टडी तो डिस्क्रिप्टिव स्टडी है, इट इज नॉट अ कंपैरेटिव स्टडी। कहते नहीं, आई हैव कंपेयर्ड दी माय रिजल्ट्स विद द इंटरनेशनल लिटरेचर। फॉर गॉड सेक, comparison with the literature does not make the study a comparative study. Number one, compare the strength and weaknesses of your results with the literature. अगर and try to show your results in numbers, not in percentage, especially in the smaller sample size. Next, please. In comparison with the literature, relate the finding to those of the similar studies. बिल्कुल उनके साथ finding आप अगर mean finding, here we inflate our data. Mean age was this and median age was this and mode was this and Mr. X has studied and his mean age was this and more. नहीं, जो mean outcome variables है उस पे ज्यादा concentrate करें. To relate the finding to those of the similar studies, explain the meaning and importance of the findings, main outcome findings, not going into the tangential issues, and state the clinical relevance, or is the basic sciences study at unka basic sciences relevance of the finding. That is why it is relevant clinically, what you are telling. So this should be, this comparison of literature should be within the 2 to 3 paragraphs, keeping in mind these points. Next, please. These are the things to avoid. Again, I'm putting an emphasis to it. Do not over-present your results, because data are data, nothing more, nothing less. ये जो 3 पैराग्राफ में आपको दे रहा हूं ना, आप लिखते हैं जो 3 पैराग्राफ में, in which you will be writing the comparison with the literature. So do not over-present your result. Number 2, the discussion should remain focused on your data, playing on your own wicket. आप अपनी विकेट पे खेलें, आप दूसरे की विकेट पे ना खेलें. दूसरी की विकेट ये है कि आप यहाँ किसी और की फाइंडिंग को लेना शुरू कर दें जो आपकी ना ऑब्जेक्टिव्स में था, ना मेथड्स में था, ना इंट्रोडक्शन में था. एंड इन्फ्लेशन ऑफ इंपॉर्टेंस ऑफ द फाइंडिंग्स ये भी अवॉइड करें. अनवारंटेड इन्फ्लेशन जो है ना वो इरिटेट्स इकबाल हैदर. चलिए जी आगे. नेक्स्ट प्लीज. अच्छा, do not go into the tangential issues and do not bully the others. Compare your result professionally. Do not criticize other investigator. Do not preach the readers. ये ओपिनियन नहीं बना रहे. साइंस इज साइंस. साइंस में कोई भी ओपिनियन मेकिंग नहीं होती. द एम ऑफ साइंस इज बेसिकली वन, एंड द एम ऑफ साइंस इज not to open the windows to unlimited wisdom, but it is to set the barriers to unlimited errors. तो इसमें आप unlimited wisdoms की बात ना करें कि आपने एक पेपर लिख लिया है और आप जो है ना बस अफलातून बन गए. जी नेक्स्ट प्लीज. अच्छा, now this is important कि who will get the benefit. क्या ये स्टडी जनरलाइज हो सकती है कि नहीं हो सकती, and who will get the benefit from your study. इसकी स्टडी की implication क्या है. Next please. Like, who is your audience? If your audience is a urologist or urologist, what benefit a urologist will take from your study? What a GP will take benefit from your study? and what the physician will take benefit of from your study, if and buts. So this is your study. अगर आप urology की एक study कर रहे हैं, let's say I'm doing a study on the urology, and I say कि this is very good for the gynecologist, जिसमें gynae ना हो, वो prostate हो, so this is something ridiculous, idiot remarks, right? Chale. Next, please. Then is very important. In the discussion phase, you will be seeing most of the people writing in the end of the discussion, further study is required on this topic. No, this is wrong. Next, please. You have to write one paragraph. If you have noticed something extra from your main outcome measures that are not explainable in your discussion, like आप जो है आपने देखा कि एक मेडिकेशन जो है इंटेरिक फीवर पे वो मेल में तो बहुत अच्छी काम कर रही थी, फीमेल में नहीं कर रही थी, या एक सर्जिकल प्रोसीजर जो है वो उसके कॉम्प्लिकेशन जो है वो एक खास एज ग्रुप में आ रहे थे या जेंडर में आ रहे थे या बॉडी मास इंडेक्स के साथ उसका कोई रिलेटेड था, जो आपकी स्टडी का हिस्सा नहीं था, but that was an unanswered question. So further research, ये नहीं है कि you just write a sweeping statement कि further research is desired on this this topic. ये topic तो आपने establish कर दिया. Further research is desired on the unanswered question. Unanswered question in which you have retrieved from your results and in the discussion. And this unanswered question is very important because a new investigator will find its research question in your unanswered question for the further research. हो सकता है XYZ आपकी स्टडी पढ़े और वो सिर्फ आखिरी एक पैराग्राफ पढ़ेगा. अगर वो if he's a smart guy, he will read only your last paragraph के इसके अंदर research hook or research gap kya aaya, and he is going to study that thing. He is not going to confirm your studies again by reinventing a wheel, right? Secondly, aapke liye you get a good chance of starting a new study on this unanswered question. Just like movies mein nahi hota, child play 1, child play 2, child play 3. So you can go for the reasons for the unanswered question in that case. Next, please. So how to write conclusion? Next, please. Conclusion should be one paragraph, and conclusion is basically the conclusion of the discussion. It is not the conclusion of the whole paper. It is the conclusion of the discussion. So link conclusion with the goals of the study, but avoid unqualified statement and conclusion not supported by the data. Next, please. Now, acknowledgement. Yes, they have to be placed between the discussion and the references. Authors always acknowledge outside reviewer for their drafts, but the acknowledgement should be brief. It should not be flowery. Next, please. Next, please. इसे एक स्लाइड पहले इसे एक साइड पहले बता दें. हाँ चले इसके बाद. हाँ ये नेक्स्ट प्लीज. अब एक स्लाइड नीचे. नहीं है ना उम्मीद इकबाल अपनी कश्ते वीरा से, जरा नम हो तो ये मिट्टी बड़ी जरखेज है साकी. So with this, I end my presentation for the question and answer, and I expect that so many participants who are struggling with the discussion, how to write discussion, should take it as their assignment purpose. Give your feedback at my email, liaqat_99@yahoo.com. Next, please. Next, please. खत्म हो गया?
Yes, sir.
हाँ, अच्छा ले सही. And this is something of a lateral thinking. Always do the lateral thinking. I have two published book of the poetry, as Atlas of the Urology. Now I'm writing a book with a Cambridge on as a textbook of the urology and Ilmul Huruf. तो हमेशा अपने ये मैं students and residents को भी कहता हूँ कि always do lateral thinking. Thank you very much, ladies and gentlemen, for listening to very attentively. And second is that I'm sorry for this this technical errors which created some disturbance.
Thank you so much, Dr. Liaqat, for that insightful presentation. We will now open the floor for question and answer. Please use the raise hand function or direct message me your question in the chat box and we will address them one by one.
Okay, so I have one chat. If I read it like chat, मुझे कुछ नजर आया था, इन्होंने कहा था किसी डॉक्टर की इनका मैसेज आया था कि how much words in the discussion.
Yes.
अच्छा, one thing is that this depends upon the instruction to the author. वो आप जरूर पढ़ा करें. इंस्ट्रक्शन टू द ऑथर में वो लोग लिख देते हैं कि यूजुअली डिस्कशन के ऊपर कोई इतनी पाबंदी नहीं होती, लेकिन रिजल्ट्स और इंट्रोडक्शन में एक रूल याद रखें कि इफ यू आर राइटिंग इंट्रोडक्शन ऑफ 1 page, योर रिजल्ट शुड बी 3 pages. If you are writing the introduction of 2 pages, then your result should be of 6 pages. लेकिन डिस्कशन में ऐसी कोई कदगन नहीं है. Until unless you cover all these 7 headings which I have discussed.
All right, sir. Sir, we have next question from Dr. Jahan. Implications can be multiple if relatable. For example, you gave example of urology, but if it is relatable, so it can be used in implications as well, like maybe for policy making, etc.
Very good, excellent. देखिए, if the sum of the implication is relatable, agreed, it should be for the policy makers also. But if I am just, if I am writing a paper on the nephron sparing surgery for the renal tumor, so most of it will be implicated to the urologist or the uro-oncologist who are doing or who may learn or he want to know the results of the nephron sparing surgery. हाँ, अलबत्ता अगर मैं सिमुलेशन इन यूरोलॉजी कर रहा हूँ तो मेडिकल एजुकेशनिस्ट भी उस पे भी उसकी implication है. Very well said.
Sir, we have next question from Aksa. Does all types of study have the same discussion? For example, same for cross-sectional and meta-analysis?
Yes. No, meta-analysis something. Yes. Every study, आप साथ ये heading याद रखें. Meta-analysis को हम नहीं include करें because ये original meta-analysis का format ही different है. वो हम कोशिश करें कि हम अपने मॉड्यूल में कवर करेंगे जब हम कल से मॉड्यूल शुरू करा रहे हैं. This is basically for the original research papers, which usually do as an original article. इनमें सब में यही format चलेगा discussion का.
All right, sir. Thank you so much, sir. We will wait for a while, for a couple of more minutes to get more questions if there is any, and we can then.
Oh, thank you. I'm here. And I'm expecting that मेरे ईमेल पे अपनी असाइनमेंट जरा सेंड करें ना कि कितने लोगों ने कितना सीखा. I can vote.
Sir, we have a question from Dr. Saima. Should we keep any specific number of studies to compare with our study in discussion?
Very good question. You have to compare. Number one, अगर कोई benchmark study है उसको साथ थोड़ा compare करें. Or recent studies, not very old, recent studies within the period of 5 years, उसके साथ compare करें. नॉट कि आप 1947 या 1970s की स्टडी के साथ कंपेयर कर रहे थे, जब वो प्रोसीजर या वो चीज खुद ही अपने लर्निंग कर्व में थी. लेकिन ऑल्सो मेंशन बेंचमार्क स्टडीज. जी.
All right, sir. Sir, we have a question from Dr. Rubina. How can writer address counter argument and multiple perspective in discussion writing?
How can we address here?
How can writer address counter arguments and multiple perspectives in discussion writing?
Dr. Rubina, in the 2 to 3 paragraphs, when you are writing this comparison with the literature, because first is a literature search कि आपको बहुत अच्छा literature search आ रहा हो. अगर आपकी स्टडी ऐसी है कि उसमें मल्टीपल पर्सपेक्टिव्स निकल रहे हैं, लेकिन उसमें इफ एंड बट्स ज्यादा हैं, कोई बंदा कह रहा है इस तरह है, कोई बंदा कह रहा है इस तरह है, सो जस्ट टेक द स्टडी नॉट फ्रॉम अ गुड सोर्स लाइक कॉकरेन में है, या अगर मेडस्केप या पबमेड पे है, उनके साथ अपनी स्टडीज को कंपेयर करें. डू नॉट कंपेयर your studies in these 3 paragraphs. Do not compare it with the grey literature. जो ग्रे लिटरेचर नहीं होता जो गूगल से आपको मिलती है, चाइनीज वाइनीज शान शू वांग की जो स्टडीज होती हैं, तो उनके साथ ना कंपेयर करें, क्योंकि देन योर डिस्कशन वी वर वेरी लेंथी. कंपेयर, contrast your results and compare in the comparison of the literature in the 3 paragraphs with a good studies, having a good number of patient sample size, have a good methodology, so then it is better to compare it with them rather with ghost authors and ghost studies.
So we have a question from Dr. Muhammad. What is the difference between writing discussion of qualitative versus quantitative studies?
ये सारी डिस्कशन तो हम क्वांटिटेटिव स्टडीज की कर रहे हैं, ठीक है. क्वालिटेटिव स्टडीज की डिस्कशन डिफरेंट है, उसके लिए आपको एक नया टॉपिक रखना पड़ेगा, क्योंकि क्वालिटेटिव स्टडीज की थीमेटिक एनालिसिस होती है, उसमें नंबर गेम नहीं होती, हमेशा याद रखें. क्वालिटेटिव स्टडीज में हाइपोथेसिस नहीं होता, हाइपोथेसिस जनरेट होता है. क्वांटिटेटिव स्टडीज में आप एक हाइपोथेसिस चेक करते हो, आइदर इज अ नल हाइपोथेसिस और अल्टरनेट हाइपोथेसिस. तो जो क्वालिटेटिव स्टडी की जो डिस्कशन होती है, दैट इज बेस्ड ऑन दैट थीमेटिक एनालिसिस कि वो किस थीम पे आप कर रहे थे. तो these 7 headings will not be relating to the qualitative study. वो अगर आप फिर कभी और या मिक्स मेथड स्टडीज होती हैं, वो अगर कहीं, because this webinar, scope of webinar will be then very, it will be beyond the scope of this webinar अगर मैं वो भी सारा डिस्कस.
All right, sir. Thank you so much, sir.
Thank you. Any question?
There ain't any further.
Okay.
So, yes, sir.
So I thank you so much, Wahab again, Iqbal, and I would like to have Iqbal as a last comment, if he's here. इकबाल है? अच्छा, उसने मैंने म्यूट किया हुआ है. म्यूट किया, was muted है. ठीक है, सही.
Hi, sir. Thank you everyone for your active participation and engaging questions. We hope you found this session valuable and informative. Please remember to complete the feedback form that will be sent to you. That is already sent in the chat box. I am pleased to announce our next session in the webinar series titled Manuscript Rejection from Editor's Perspective, which will be held on 27th of July 2024. Our next speaker will be Dr. Lamia Yusuf, who is ex-professor of the Obs and Gynae and is currently assistant professor, director of medical education, University College of Medicine and Dentistry, Lahore. I am also pleased to announce that third annual International Research Conference KMC 2024 will be held on 2nd and 3rd of October. The theme of which is research culture bridging the gap between classroom and clinical avenues. The activities will include poster presentation, verbal presentation, and state-of-the-art lectures by renowned researchers, both international and national. Once again, thank you, Dr. Liaqat, for your time and expertise. Have a great day, everyone.
Thank you so much. Thank you so much, Rahab. So may I leave here now for the OT?
Yeah, that's perfect.
Okay, thank you so much.
Thank you so much, sir.
Thank you very much for the nice session.
Thank you so much.